Now is the methodological framework, and the first step is the research design. For this research, it used an experimental design because we need to compare if the vaccine works for people of different ages, and in this experiment, there were used control and experimental variables. The variables are related because measuring the efficiency of the vaccine will help in the study because the independent variable that was the Pfizer vaccine is related with the dependent that are the number of infections, because if it is applied, the number of infections should go down. The efficiency of the vaccine is an abstract concept because it was measured by doing an experiment that consists in divide two groups. Now, the second step of the methodological framework is the participants, and the demographic characteristics of our participants are two groups of people that are divided by the ones that have the vaccine of COVID and other patients that get an injection that functions as a participants went from 50 persons in the first phase of the clinical EC, where 25 of the persons have the COVID-19 vaccine and the other 25 people get injections with placebos. Then there is the material and equipment, and for this experiment not many materials were needed, but some of the ones that were used are the vaccine, the type of vaccine that was used, that in this case are the Pfizer COVID-19 vaccine, and lastly the participants had to take a COVID test and another test to see if they don't have another disease. And the method was to use an experimental treatment and check if there were any secondary effects. So in this was the researchers of this vaccine can determine the amount of doses needed. Now there is the experimental procedure. Pfizer did a 4-step procedure to see the efficacy of the vaccine. The first step was about demonstrating that the vaccine is safe to use in people, and for this step they use a small group of people. The second step is about evaluating the efficiency of the treatment to treat a disease. The secondary effects are studied and it involves a bigger amount of participants. Basically for the third phase, what they did is to reunite additional information about the effectiveness and safeness of the vaccine, and for this phase they are involved from 100 to 300 persons. Finally, the fourth phase of this process is also called post-marketing studies, and they take place after the regulatory approval, and it is very important to see if the treatment will be used. And for this phase, they use a number of people like from 1,000 to 5,000, and in this step, the scientists also search for long-term risks, benefits, and optimal use.